and welcome, ladies and gentlemen, to this month's episode of Aap Ki Sehath, meaning your health, a very special presentation by Indian Medical Association of Queensland. Let's get into the show as we progress in with the show. So right now, let's move to the show for this month.
Hello everyone. The Indian Medical Association of Queensland has been running a public health lecture series since March 2020. Our members, who are doctors of Indian origin and practice in this wonderful state of Queensland, they volunteered their valuable time and expertise in this endeavour. The advice given by any doctor is of general nature and meant for information and education only. Please note, this is no substitute for your own healthcare professional, and everyone is advised to consult with their own treating physician for ongoing health issues. I will now ask the Secretary-General of IMA Queensland, Dr Cyril Fernandez, to introduce to you our guest speaker of this month.
Hello listeners, welcome back again to another episode of Aap Ki Sehath program, meaning your health of the Indian Medical Association of Queensland. Today we have our guest speaker, Dr Supratik Sen Gupta, who is a leading pediatrician. He works at St Andrews Private Hospital in Ipswich, Sunnybank Private Hospital, and also at the Institute of Urban Indigenous Health at Logan Lee and at Ipswich Clinic as well. Welcome, Dr. Gupta.
Thank you so much, Dr. Cyril.
So, we know that you are a pediatrician specialist. Our viewers would like to know more about your field of expertise in medicine as a doctor. But prior to that, Remia must have told you listeners about the public health message from IMA Queensland. So let me start with my first question, asking Dr. Gupta about a bit of his background, why he chose to work with children, and what are the most important issues in children nowadays. So, Dr. Gupta, please tell us something more about you, yourself, your background, your qualifications, experience, and so on, where you worked and things, starting from your homeland,
Yeah. So, thank you so much, Dr. Cyril, for having me in this program. I'm really honored.
Welcome.
And I don't know whether I'm the leading pediatrician or not, but I try to do my level best in helping children and families in Queensland. So, I come from a city known as Kolkata or Calcutta, which was known previously, which is in the eastern part of India. I was born there, but I was raised in Allahabad, which is a central town in Uttar Pradesh, and I started my schooling there up to grade 7, and then after that my father got transferred to Calcutta, and so I came back and started my studies at St Xavier's Collegiate School from grade 8, and I finished my graduation in schooling from grade 12 from that college, and then I managed to get through the entrance examination, which, as you would know, is always hard for us.
Yes.
Because we compete with so many and with limited seats. So I got admitted into Nil Ratan Sarkar Medical College, which is one of the leading medical colleges in Calcutta. And there I finished my graduation and did my MBBS. During the course of the MBBS, after finishing it, we also have to do an internship, in which we rotate for 3 months in each the departments. So surgery, general medicine, preventive and social medicine, gynecology and obstetrics. And so when I did all that, I did not have any contact with pediatrics or children at that point in time, because when I graduated, the discipline of pediatrics as a subspecialty had not come up at that time. So unless you are a really good student, you don't get to choose, or you don't get to work with children as in a pediatric ward. But fortunately, I did, because I had done very well in my exams, I managed to get that. But what happened was that there were some social circumstances, and my mother wanted me to go and work in Ramakrishna Mission Seva Pratishthan, which have their own hospital. I was actually born there. So there was a bit of a sentiment attached to that. So I chose to start my pediatric career at Ramakrishna Mission Seva Pratishthan in Calcutta. Now, to answer the question as to why I chose pediatrics, I know at that point in time it's probably seemed a bit silly, but I did not gel looking after adults. Even though I knew I was a very good physician, somehow I knew that I could bond very well with children. And plus, at that point in time, being a good student or a good intern, you try to get the best, and pediatrics was one of the top of the list, so I chose that. And I don't have any regrets.
Specialty in demand.
Yes,
yes. You know that all
Yeah.
of us who come from India,
Yes.
it's not easy to get into
No.
MD pediatrics.
Yes.
You've done well in that regard here. Give us
Yeah.
more insight.
Yeah, so I got into there, and Ramakrishna Mission had one of the best pediatric units in the eastern part of the country at that point in time. It was really busy, and going every day to work was absolutely fascinating, because you are learning about a totally new field, which I had not been exposed to previously. The world of children is totally different from the world of adults,
Absolutely.
because when you're seeing a child, you're seeing a child itself, you're seeing the whole family as a whole. So you've got the father and the mother and the grandparents and the extended family. They're all worried about the child. So you have to interact with these people as well, and it's very tricky. And not only that, with limited facilities of treatment that were existing at that point in time, it was really challenging for us to provide the best care for children. And unlike in Australia, I grew up experiencing a lot of deaths in children, not only in the neonatal age, but also in the infancy and in bigger kids. We did not have a ventilator at that point in time. There was no pediatric intensive care unit that we know as they exist across the world. And it's only towards the end of my training that we got a ventilator, and to be honest, no one knew how to run it. Yeah. So I was really handicapped, and I was really frustrated, because I remember there was a period of time in 1994 and 1996, we had a dengue hemorrhagic fever bout that went through the whole country, and it was really bad in West Bengal as well. And on average, we used to admit about 20 children with dengue hemorrhagic fever or dengue hemorrhagic shock to be looked after by us. And I could remember that there was a mortality of about 70 to 80%.
Oh, really?
And I have seen children die just from bleeding. We are giving all kinds of blood products, full packed red cell, cryoprecipitate, fresh frozen plasma. Nothing was working, and it was just horrible. And so, after completing my diploma in child health, I wanted to come abroad to get some more training in intensive care, even treatment. So to that end, I went to, I tried to get into the UK. Unfortunately, at that point in time, getting into UK and getting a job was extremely difficult. And you must have heard that there was incidences of doctors not able to get a job and going to the temples in the UK for meals on a daily basis. So I was thoroughly discouraged by
Which year was that?
That was 96, 97.
So
97 onwards.
yeah. Good to know that you worked hard, became a doctor, did your graduation, then you slowly developed that passion towards children, family-oriented things, and that passion, in spite of seeing the mortality and sad deaths of serious children, you still went on with the passion to UK to pursue the specialty, which is very interesting. So tell us, viewers, a bit more about it, Dr. Gupta.
Yeah, thank you so much, Cyril. Unfortunately, my parents did not allow me to go to UK. So I went on to do a diploma at National Board, which was at that point in time getting more recognition in across the country. And so I did my further training at Telco Hospital, Jamshedpur, under Dr. R.K. Pancholi. And that was a fascinating sort of journey for me, because at one go I was able to, it was a really good unit. I was able to work in a unit which had not only an intensive care nursery, but it also had a pediatric intensive care unit, which was two-bedded, but it was run by an anesthetist. So I got to learn a little bit more of how to look after these very sick children. Now, as you would know, Telco Jamshedpur is in Jharkhand, and at that point in time there was not Jharkhand, it was actually part of Bihar. So there was this agitation going on politically to get it separated from Bihar, So the Tatas did very well, because not only they were looking after the families of the employees, but as a non-employee, you could actually get one of the best cares, provided you had a backing of an employer. So based on that, we used to see a lot of indigenous kids, because there it was actually the scheduled tribes, the Santals whose kids used to be very sick, malnourished.
Yeah, when you were saying about the indigenous population, that's also a big thing now that we are all working in Australia,
Yes.
In my view, let me ask you whether the conditions are similar, like presentation of asthma, eczema, skin conditions, any other. What are the predominant conditions you have come across in such children?
Well, I think more of infectious diseases.
Oh, really?
Yes. Yeah, not here, but I'm saying in India.
Yeah, right.
Yeah, just in a lot of different infectious diseases, which fortunately here in Australia we don't get to see, because we have got a almost 99% immunized population in the pediatric age group. So I think as a result of that, the infectious load is much less. So we get to see all the other kind of presentations like asthma, allergies, developmental and psychosocial behavioral problems.
Sorry to interrupt you. That means now for viewers, you are giving a strong suggestion, recommendation that the preventative medicine, the immunization plays a big part in children's health.
It is
so
absolutely.
Parents of Indian origin should not be reluctant
Not at all.
not to immunize them based on some small side effects, which when you compare with other mortalities due to other reasons. So
Cyril, to be very honest, I was part of the universal immunization program, in which we used to immunize children with polio and other infectious diseases. And you would be surprised to know that the uptake in the general population was so high. And when I see the skepticism that is prevalent in this society, in this well-to-do Western affluent society, it is absolutely gobsmacking. I just don't, and I cannot rationalize, I cannot think why would these people not want to have this kind of vaccination.
The non-fact that when you immunize the children, the parents, the herd immunity improves, the community gets healthier.
Absolutely. I worked in slums in Calcutta, in West Bengal, and the uptake is so fantastic,
So the cost was government giving it free to the
no,
population?
I think there's a lot more to
Education was needed,
I think education plus the political will as well was there.
All right.
Yeah, the political will was there. The political leaders at that time, they realized that if you want to have a polio-free India, you'll have to have the immunizations, and that's why they promoted it so much,
Yeah.
Plus, the bureaucrats that were backing this program, they were totally committed. So I think the whole society got together to get rid of polio, So when I come to this country,
Smallpox is one big example of eradication.
Yes. And so we don't get to see a lot of those infectious diseases components here, because They have done very good work here as well. But slowly over the times, there's a big skepticism that is creeping into the society for different kinds of vaccinations. As a result, you see a lot of the infections that we had thought that had gone away, like measles, mumps, rubella, and whooping cough, they're coming back because of the skepticism. It has happened in Europe and it's happening here as well. So on an average, in Australia, about 2 children will die from whooping cough. And it is really sad, because once you get it, it's very difficult to control it. I mean, you've got all the ICU facilities and everything, but
the spread is terrible.
yes.
Rapid.
So that's why I make sure that whenever I see a newborn, I just ask the simple questions: have you, the parents, been vaccinated with whooping cough, or the grandparents have been vaccinated with whooping cough or not? It's so important.
What is your opinion on the meningococcal vaccine, which most of the viewers may not be aware of the importance of such a deadly, in the infant population, especially,
Yes, meningococcal vaccine has been promoted in the last probably about 10 years, so in a decade. And since coming to Australia, I've probably seen about 4 or 5 children with meningococcal infection, and the effects are absolutely devastating. Once you get it, there is no guarantee you're going to survive that.
Symptoms and signs should the parents, be aware of in such a situation?
So for children who are small in the infant age group, it will be, the first thing will be, they will be very sick. They'll get high grade temperatures. They'll go off food, and they'll become very lethargic, and they may start developing small petechial rashes. Petechial means pinhead. The size of pinhead, that's our rashes.
So rather than...
So fever with rash and a lethargic child, you have got to be very careful, and you need to go to the emergency straight away.
No home medicine, don't wait.
No, not at all. I would never,
That's good advice.
I will never ever advise, and you don't know, there's also thing called herpes encephalitis. So that is another quite deadly disease that is... We should know about it, and we should be very careful, because one of my own friend's child ended up with herpes encephalitis, and right now she's a cerebral palsy child.
Is it like called brain fever or something in layman's terms?
No, it's not brain fever. It starts off with a rash, which is very similar to chickenpox, and then there will be temperatures. Sometimes there's low grade temperatures, but the child is not well, So the doctor who is looking after the child should have a high should have a very high suspicion of this kind of condition.
In the context of the vaccination, if you can highlight something about the COVID vaccine, I'm sure most of our listeners, parents, will be concerned about the COVID vaccinations for young children, whether it's required. We know that Pfizer vaccine is only from 16 years and above. The other vaccine still at a high age. So what about the young children?
So children below the age of 16, across the world, there has been very few incidences of morbidity. So children, even though they have been affected by the COVID vaccine, with the COVID infection, but they have not developed the serious infection which is fatal to adults. And that is because their immune system is so good. Having said that, we have seen in the last probably 12 months that a lot of children are getting flu-like symptoms, and which was not there last year because they were in lockdown and there was social distancing. So what has happened is that because there has been lack of intermingling, the general level of immunity in the children has gone down, and so as a result they are able to catch all these kind of common viral illnesses. So my suggestion to you that there is no need for panic. Across the world, so 7 billion people, there have been hardly probably about 20 such cases in which children have had some kind of bad side effect, or they have passed away. It is so low, and I mean, there's more chance of your child having some kind of accident, motor vehicle accident, or some kind of self-harm sort of suicidal problems, depression, those sort of things are more likely than your child actually dying from a COVID infection.
Dr. Gupta, you have covered quite a lot of issues related to children's health and immunization. Now, due to the time constraint, we have to summarize the first part, and viewers, we will still have Dr. Gupta on the second part of this program, continuing with other issues in the pediatrics, in children's health. But prior to winding up, I would like Dr. Gupta to summarize, like common, we went to the more serious conditions.
Yes.
So summarize briefly some pediatric conditions, and then in your second talk, we would like you to highlight on asthma, the mental health thing, what you said, depression and things. People think it's only on the elderly. No, not the adults, even children. So we'll go to the viewers. On the second part, we'll highlight more on that. We'll ask Dr. Gupta to give us his expert opinion on that. Now I will let Dr. Gupta to brief and summarize the part one of the show, please. Thank you.
So look, the take-home message for the viewers is that they need to follow the Australian immunization guidelines, and whenever the COVID vaccine is available to children, they should not hesitate to take it. Every vaccination has got its side effects. Even polio vaccine had its side effects. Even diphtheria vaccine had its side effects. Nothing is without side effect. Who is going to get a side effect is very difficult to predict. Okay, but we have seen that in a large population, probably 0.001% of children will get some sort of side effect, and it is very negligible. It is obviously devastating for that family, but I would say in the larger interest, it is very important that everyone should follow the scientific guidelines that is laid out by the Australian government and follow the Australian immunization schedule. And if the COVID vaccine is available for children below the age of 16, they should not hesitate to take it.
That's good advice from you, Dr. Supratik Sen Gupta. Viewers, with this we wind up today's Indian Medical Association of Queensland's Aap Ki Sehath program, and thank you very much, Dr. Gupta, for imparting to us viewers, sharing with us your vast knowledge in the field of children's health, pediatrics. Thank you so much.
Thank you, Dr. Cyril, for having me, and I'm really grateful to you.
And thank you very much for Dr. Cyril Fernandez and Indian Medical Association of Queensland for bringing this monthly update. And in today's topic, as we mentioned and as we saw that children's health, which is very, very important. See, as the doctor quite rightfully mentioned there, that it does not affect only the adults, but children as well. So looking forward to part 2 of that. Once again, I'd like to place on record our appreciation for Indian Medical Association of Queensland, and especially Dr. Cyril Fernandez for bringing the monthly issues to you. So, ladies and gentlemen, this has been a special presentation of IMIQ brought to you by Australian Indian Radio and live streamed by Chentex Multimedia Services. Until the next episode, is goodbye from us.